Hi, my name is Dr. Melissa Chang, and I'm a dermatologist at Integrated Aesthetics. And today I am super excited to tell you about how we as dermatologists and providers in the aesthetic world use skin color to make predictions. We all know that skin comes in an infinite range of colors and can range from pale white all the way to ebony black. And even within the same person, we can have a range of skin colors. So for example, if you look at my face, you'll notice it's a little darker than my neck, and my neck, I'm almost certain, is darker than my armpits. As well, during the summer, I'm going to be a little bit darker, sometimes more dark, than I am in the winter. And so as dermatologists, what we do literally every day is we use a scale, which is called the Fitzpatrick Skin Scale. And what it does is it divides that huge range of skin colors into 6 groups. And what these groups do is to help us make predictions of how skin is going to respond. Let's go over the 6 groups. Sometimes we refer to them by number, so I am going to number them as I go along. Skin type 1 is called light, and the description is always burns, never tans. Skin type 2 is fair, usually burns, tans with difficulty. Skin type 3 is medium to olive, and that skin type sometimes burns and gradually tans. Skin type 4 is olive, rarely burns, tans with ease. Skin type 5 is brown, very rarely burns, tans easily. And skin type 6 is dark brown, never burns, tans very easily. And in my practice, I actually use the scale daily, every time I evaluate a patient. In my medical practice, I use the scale to predict when someone has inflammation. It could be a pimple, it could be a rash, it could be trauma from surgery or an accident. And it helps me predict how is the person going to scar, and also, are they going to have redness or pigmentation? And even I can make a prediction of how long that pigmentation will last. In my aesthetic practice, it helps me predict how a person will age, as well as how they're going to respond to treatments, especially treatments that cause a little injury to the skin, such as lasers or heat. And then I also do research, and as part of our research studies, the FDA requires us to classify each patient based on their skin type when we're doing aesthetic studies. The scale is very common, I use it daily, but it actually has some limitations, and they're pretty big ones, because it was originally developed so that we could, as dermatologists, predict the risk of skin cancer in a patient. But it was never designed to predict aging, response to inflammation, response to scarring. And so in my own practice, I had some workarounds. For example, all East Asians I would classify as a skin type 4 when I'm trying to predict pigmentation, no matter what color their skin was. I was excited to find last year, in response to these difficulties, Pearl Grimes, who was one of the experts in the field of dermatology with a lot of experience in skin of color, made a recent proposal for an updated classification. And the goal of this new classification is to better predict the risk of disease and also the risk of adverse events from treatments. And it is based on not only color in response to the sun, but ethnicity as well. And so the scale builds upon the Fitzpatrick Skin Scale. And you'll notice, if you look at it, it keeps the numbers and the descriptions in response to sun very similar to the Fitzpatrick Scale, but there are also additional columns that predict acne, scarring, and hyperpigmentation, and as well characterize the patient's racial ethnicity. You will also notice that skin types 4 and 5 have been broken down into an A and a B category. And the reason why the authors did that is because we have found in clinical practice that there is such a broad range in skin types 4 and 5 in terms of response to aging and sun exposure and trauma that we would better be able to predict if each of those numbers had an A and a B. So I hope you enjoy. See if you can figure out your own skin type. We will also include some color maps so that you can compare to your own skin. If you like this video, don't forget to hit the thumbs up button and subscribe if you want to see future content. As well, I'm always interested to know what you're interested in learning more about in the fields of dermatology or aesthetics. So let us know in the comments.